Fever. Fever means that your body is hotter than it should be. A normal temperature is 98.6 degrees. The way to measure your temperature is by placing a thermometer either under your tongue, into your armpit, in the anus, or sometimes in the ear. Oral temperatures tend to be the most accurate. Temperatures can be normal between 97 and 99 degrees. If the thermometer says any number higher than 100 degrees, that is definitely a fever. You may develop a fever if your body is fighting an infection. You may get a fever if you have arthritis or thyroid problems, if your immune system is weak and not working very well, if you have cancer. Some medications can cause fevers. Sometimes fever occurs and we don't know the reason. Symptoms mean the different feelings you have when you're sick. Some people sign it this way. With a fever, your body feels warmer than usual. You may have pains in different places in your body. You may feel extremely tired and want to lie down to rest. You may also have chills, and maybe you'll sweat. To diagnose a fever, one way to tell if someone has a fever is if their skin feels very warm. A fever is found by taking the person's temperature, either by placing the thermometer under the tongue or in the ear, under the arm in the armpit, although this is not the best way to get an accurate reading. There are different types of thermometers. Fevers can cause other problems for the patient. The body can become quite hot. Breathing can become fast, which is not good for your heart and lungs. If your body's overheated and you sweat a lot, you may become dehydrated because of losing so much water. Older people may become confused and disoriented, unable to think straight. Fevers can cause other problems in the body. The doctor can give you medicine to help bring your fever down. The doctor will provide a sheet of instructions about how to use the medicine, and you should follow them closely. Sometimes a warm shower, not extremely cold and not extremely hot, can help with a fever. Drinking water or juice is very important to keep hydrated. When you get home, wear clothes appropriate for the temperature, not too heavy and not too light for the weather. And again, drink a lot of water. It's really important. You should go back to the ER if your breathing is unusual and doesn't feel right. If you feel disoriented and pass out. If you use the bathroom and only a little urine comes out, and this continues for a while. If you notice new pains in your head or neck or chest, or any other new pains that weren't there before. If you start vomiting for no reason. If you drink water and it makes you vomit and you can't keep the water inside your body. If your neck is very stiff and you feel like you can't move it. If lights seem too bright and they're hurting your eyes. If any of this is happening to you, take your temperature again. If it is 102 or above, go to the ER. You should see your primary care physician if any of these occur. If you have vomiting and/or diarrhea, if you develop a skin rash, if your temperature goes up to 102 or above and lasts for 3 days, if you feel weak and disoriented as if you will pass out, and you're thirsty, if your fever goes away and then suddenly appears again. If any of these things happen, make an appointment to see your doctor.